My name is Kleman, and I am a prevention manager with Children's Hospital of Wisconsin Community Services Division. And in my role at Children's Hospital, I work on a variety of prevention programs, child abuse prevention in particular, by heading up a couple of statewide initiatives. The first one is Awareness to Action, which is the Wisconsin Child Sexual Abuse Prevention Project, and Prevent Child Abuse Wisconsin. And I am here this afternoon, I almost said this morning, I'd be 1 minute off, to kind of kick off this series about ACEs and trauma-informed care. So how many of you have heard the term ACEs or know what ACEs is? So a few of you. Do you have an in-depth knowledge? Just you kind of know what it is and that's about it? I'm seeing heads go like this. Have any of you really attended a full-blown ACEs presentation? Okay, that's good, because what I'm going to give you today in 45 minutes, I normally do a 2-hour presentation on. So this is going to be very condensed, very basic, and what I want to do is lay the foundation for you. Because I just picked up the sheet that tells what's coming after what I present, and you're going to hear about trauma-informed care and how to work with individuals who've had that type of trauma and ACEs in their life. So what I'm doing today is just laying that foundation of why this is so important and giving you some educational information around what are ACEs and the trauma that people have in their lives as children, how that affects them throughout their life, into adulthood, and then even as they're parenting their own children. So I did just a real brief before we started where people are from. I heard a lot of human services. We had a pastor, we had some HR. Anybody else in some other field?
Human services.
Human services. Pardon? Victim witness.
Clerk of courts.
Clerk of courts. How many of you work directly with kids and their families?
I don't work with them.
Okay. And then the rest of you probably see them, obviously, clerk of courts, you see the families, victim witness, you see families. So we're going to start basically laying a foundation of what are ACEs and how trauma affects people throughout their lives. So when you talk about ACEs and you hear that, basically what it's referring to is adverse childhood experiences. And the whole idea of ACEs came out of a study that was done by the Center for Disease Control and Prevention in Kaiser Permanente that had over 17,000 participants. The interesting thing about the ACE study is they weren't looking for what they found. And we'll get a little bit more into that. But before we start with that, Biology 101. No, I have a degree in counseling and in PR, not biology. So this is very, very simplistic, but it's going to give you the ideas that we all know you have the nervous system. And when we talk about adverse childhood experiences, we need to start with how our nervous system works, and that we have nerve cell, the single nerve cell. So our synaptic density of those nerve cells, at birth, there's not that many there. We don't need to know how to do a lot at birth. We need to know how to get our basic needs met. We need to breathe. We need those types of things. As we learn things, as we have experiences, those experiences help us get denser. Our neurons, we grow more, we learn more, we know more. By the time we hit puberty, though, some of those start to fall away, the ones that aren't used. I've heard it referred to as pruning. So those that aren't there, you prune off. I just attended a seminar too where they talked about it, like when you go cross-country skiing or snowshoeing, there are certain paths, and those paths develop grooves. And the deeper the grooves, the more people use them, the more they go on that path. Where a path might have been used once, but if it's not used again, its nose over it and you can't see that path anymore. So that's basically what we're talking about with the whole idea of growing that density and then pruning it off. So when you talk about children who have some type of trauma in their life, or they're constantly on edge, they get, those neurons are the ones that keep being activated. And there's basically two life paths then. You have the upper one, where you have a child who's continuously in trauma, continuously in danger. It triggers the flight, fight, or freeze. They know how to survive in the worst conditions. Going down the other way, if your childhood experience is very safe, you think about people, process, and possibilities, they know how to survive in the best case scenarios. So basically, our biology is teaching us how to survive, whether it's in that worst case scenario or whether it's in the best case scenario. So if you think about the type of child who might grow up in that fight, flight, freeze, what type of thing or occupation might they be really good at?
High stress.
High stress. What might some of those be? Law enforcement.
Unpredictable.
Something that's unpredictable, yeah. What type of occupations?
Firefighter?
Pardon?
Firefighter?
Firefighter. Something where that hypervigilance that is a good thing. But what happens when that child that's been taught to be hypervigilant, that's been taught to survive in these worst case scenarios, what happens when they go to school? What are some of the things you need to know when you go to school?
How to sit still.
How to sit still. What else?
Listen and follow directions.
Listen and follow directions.
Structure.
Structure. So think about that child that was on that upper track. How are they going, what's going to happen to them when they come into a school with all of those expectations?
They won't be able to function or pay attention.
They won't be able to function or pay attention because they've been wired to survive in a different environment. Now, some of the pushback we tend to get back, and we'll get into it later, is this is just excuses for poor behavior. You're giving people excuses. That's not at all what I'm talking about or what any of your subsequent speakers will be talking about. We're trying to show you the biological basis for how some of these families and how some kids are actually wired. And that the way that we are trying to interact with them or what we're trying to do with them just can't work. And we need to find a different way. I'm going to show you a really quick video that I think does a nice job of summarizing what I just presented to you.
Science tells us that the experiences we have in the first years of our lives actually affect the physical architecture of the developing brain. This means that brains aren't just born, they're also built over time based on our experiences. Just as a house needs a sturdy foundation to support the walls and roof, a brain needs a good base to support all future development. Positive interactions between young children and their caregivers literally build the architecture of the developing brain. Building a sturdy foundation in the earliest years provides a good base for a lifetime of good mental function and better overall health. So just how is a solid brain foundation built and maintained in a developing child? One way is through what brain experts call serve and return interactions. Imagine a tennis match between a caregiver and a child. But instead of hitting a ball back and forth across a net, various forms of communication pass between the two. From eye contact to touch, from singing to simple games like peekaboo. These interactions, repeated throughout a young person's developing years, are the bricks that build a healthy foundation for all future development. But another kind of childhood experience shapes brain development too, and that's stress. Good kinds of stress, like meeting new people or studying for a test, are healthy for development because they prepare kids to cope with future challenges. Another kind of stress, called toxic stress, is bad for brain development. If a child is exposed to serious ongoing hardships like abuse and neglect, and he has no other caregiver in his life to provide support, the basic structures of his developing brain may be damaged. Without a sturdy foundation to properly support future development, he is at risk for a lifetime of health problems, development issues, even addiction. It's possible to fix some of the damage of toxic stress later on, but it's easier, more effective, and less expensive to build solid brain architecture in the first place. One of the things that sturdy brain architecture supports is the development of basic emotional and social skills, an important group of skills which scientists call executive function and self-regulation can be thought of like air traffic control in the child's mental airspace. Think of a young child's brain as the control tower at a busy airport. All those planes landing and taking off and all of the support systems on the ground simultaneously demand the controller's attention to avoid a crash. It's the same with a young child learning to pay attention, plan ahead and remember, and follow lots of rules. Like all of us, kids have to react to things happening in the world around them, while also dealing with worries, temptations, and obligations on their minds. As these demands for attention pile up, air traffic control helps a child regulate the flow of information, prioritize tasks, and above all, find ways to manage stress and avoid mental collisions along the way. Having this ability is a necessity for positive and level mental health. Developing effective air traffic control, overcoming toxic stress, and building solid brain architecture are things kids can't do on their own. And since strong societies are made up of healthy, contributing individuals, it's up to us as a community to make sure all young people have the kinds of nurturing experiences they need for positive development. To build better futures, we need to build better brains.
So if any of you are interested, that albertafamilywellness.org, they have a lot of those type of videos, and they're free to download and free to use. So if you want to show them to anyone else, if you want to use them at a staff meeting, feel free to do that. So at the end of that, and as we talk about this, again, I'm laying the foundation, but what I want to stress is we have a choice. And my passion is in prevention. And as this so well pointed out, we have such an opportunity to work with youth and to work with young children to help get them through some of that toxic stress, to help support them so that we don't have to come at it at the back end as adults. So let's get down to the actual ACE study. What they found with the ACE study is that childhood adversity affects a multitude of public health problems. So the initial ACE study was done by, as I had said, Kaiser Permanente in conjunction with the CDC. They weren't looking for this. What happened is one of the physicians in the study was trying to figure out, he had people in an obesity study, and he would find that people would lose weight, and then all of a sudden it would turn around and they would gain it back. So he started a study asking beyond the questions of, what are you eating? Are you exercising? That type of thing, and dug somewhat into their past. And what he found was a correlation between abuse and the people in his study. So he wondered, was there more? And that's when the CDC came in and they did the study. So this was done in the early 90s, 17,000 people. Now the makeup of the people that were surveyed were mainly white, They were mainly employed because they had health insurance through Kaiser Permanente. Most had some type of higher education. And what they found was startling to them. And we'll get into that but start with, this is what they looked at. They looked at the area of household dysfunction, neglect, and abuse. So household dysfunction was substance abuse, divorce, mental illness, battered mothers, criminal behavior, emotional or physical neglect, emotional, physical, and sexual abuse. Now, the study has had some pushback around, well, that's not all of the negative experiences children can have. My own issue with this study is when they studied sexual abuse, they just asked, has an adult or someone older than you? And what we know in the field of sexual abuse is most abuse is peer. So even with the idea that they were missing so many things, this is the type of thing that they found, that a lot of the adults that they were surveying had some type of ACE. You had 33% of the adults with 0 ACEs. 26% had 1, 16% had 2, 10, 3, and 16% had 4 or more. Now, the other piece to know about the study is it didn't measure how many times something happened. So if you reported sexual abuse 1 time or 10 times, it counted as 1 ACE. If you talked about a parent having a substance abuse issue, it didn't matter if it was both mom or dad, just mom, dad, that was 1 ACE. So 1 occurrence was 1 ACE. What they found is what they call a dose-response relationship. So as the number of ACEs go up, so do the percentage of people with health problems. And those health problems run the gamut. Those of you in human services or myself, before I really started diving into the ACE study, I figured mental health problems. Yeah, I could see that. But what they found is so many more physical health problems and ailments. I'll just give you an example of a few. ACEs, smoking, and lung disease. Again, you see that dose response. On the bottom, the number of ACEs, top percentage of people. As your ACE score goes up, so does the percentage of people with that issue. ACEs, alcoholism, and marrying an alcoholic. Dose response. The more ACEs you have, the higher that goes up. Depression. More ACEs, the more that reported depression. These are just some of the examples of what they found that dose-response relationship with. As the number of ACEs go up, so do the number of people reporting all of these issues. And here's what we call the ACE pyramid. And again, this is all over the internet if you want to look at it. From conception to death, when you have your adverse childhood experiences, especially as those adverse childhood experiences tend to pile on, you have that disrupted neurodevelopment, which leads to social, emotional, and cognitive impairment, which leads to the adaptation of health risk behaviors, which leads to disease, disability, and social problems, which then can lead to early death. Any comments on this? Is this what you thought the ACE study was? Is this what you thought you would be learning? Any surprises? What about the biological component? Nothing? Do you find that compelling, or do you think it's another excuse for poor behavior? No?
It just really reiterates that it's mind and body and all of it go together.
Mm-hmm.
It just all goes together, and it's so recent in medicine that we're actually looking at that over the scheme of things.
Right. Can any of you, as you're thinking about your work, see kids or families and maybe look at them a little differently than what you had before? Part of what you're going to learn with trauma is flipping some of the questions that we ask. And instead of asking, why are you doing that, asking what happened to you. Because sometimes until we get to that what happened to you, we can't get to the why are you doing this. Because the why are you doing this can be tangled in with all of that trauma. And they have a trauma response. There's a school in Washington, and I don't know if Wisconsin Rapids or your area had the Paper Tigers video. Are you showing Paper Tigers?
We're showing it next Wednesday at the McMillan Library, and there's also a showing in Yakuza the 26th in the morning for the students there.
Good. Paper Tigers is an example of how a school took the whole idea of ACEs and trauma and flipped what they were doing from the why are you doing this to what happened to you. And then the success that they found with students, because when you have a school where you have students acting up and you suspend them, that's a lot of times what the kids want. They don't want to be in school. So flipping some of that and working with them and talking about the why are you acting this way. And they have a bullseye, and again, it's part of the larger presentation, but I think I took it out of this, is it's a bullseye with green, yellow, and red. And the red is actually, don't talk to me, I'm in a state right now that I'm not going to hear you. And so often when we're talking with children and families, especially when they're in some type of trauma or they've gotten into trouble, as our society would say, we're trying to talk to them when they're in that red zone and they can't hear us. And think about yourself when you're really angry, when you're really agitated. If someone's trying to reason with you, can you hear them? No. So there's the red zone where they don't even bother trying to talk to me. Then there's the yellow zone where just give me some time, and then there's the green zone where, okay, I'm at a state right now where I can hear you and I can listen to you, so now let's talk about it. So working with your families, finding out what is their what. Part of my background is I used to run a sexual assault crisis center. Now, I don't want to pretend that I was incredibly brilliant. Because I worked at a sexual assault crisis center, I knew why people were coming there. But I would work with women, we mainly worked with women and kids, some male survivors as well. And I would talk to women who had seen multiple therapists and multiple doctors, going in with complaints of anxiety, depression, high blood pressure, obesity, all of those issues. And they would be talking to me when they're in their 40s, 50s, 30s. And they would say that this was the first time they ever told anyone about their sexual abuse, a professional. And I would ask, in a way better than this, basically why? Why didn't you share with your physician when you were talking about your high blood pressure? Why didn't you share it with your prior counselors when you were talking about their anxiety? You know what their number one answer was? Anybody take a guess?
They never asked.
They never asked. Nobody ever asked. We try to treat that surface. You're coming in for depression, let's treat your depression, you're done. You're coming in for high blood pressure, let's give you a pill. We don't try to look at what those underlying currents are, what is causing some of this. We've also looked at ACEs in Wisconsin. So, as part of the Behavioral Risk Analysis Survey in Wisconsin, we asked some of those same ACE questions. This is an old slide because it only goes through 2012. We asked it all the way up till 2015. So these stats have changed some, but not appreciatively. Because basically what we found are the same things in Wisconsin that this nationwide survey found. And we just lost the overhead. I don't know what happened.
There's Brad.
Oh,
It was a warning, but it was too good for me to read.
It just took a break.
it did. It got tired. It got hungry too. So what they found is ACEs are common, ACEs are interrelated, and they're associated with all those same type of things. And when you look as a society and we're looking at what type of laws we're passing and what we're doing, you're also finding ACEs impacting socioeconomic status, Medicare Badger Care enrollment, and general quality of life. This is I think there's one more recent map, and you can find Wood County, and you're colored in the 15 to 20% of individuals reported one or more ACE when they were surveyed in your county. Now this map changes as we get more data, and it's not that either county gets worse or better, it's just that we get more data, so we're able to better do that. So does that surprise you that your county's a little bit on the high end? Is that kind of what you thought?
This is 2011.
Mm-hmm.
Well, knowing about, that we are the hub for heroin use and meth, I would say that is consistent with your findings.
Mm-hmm. So 58%, of Wisconsin adults reported growing up with at least one ACE, and 25% of more of those reported 4 or more. These were the specific ACE types that were reported, mostly household member incarcerated, domestic violence, physical sexual assault, mental illness, AODA, emotional abuse, and divorce. Educational attainment. So this is almost somewhat the opposite, that as you have a higher attainment, the fewer ACEs you have. So with college, 0 ACEs you have, 40 plus, 4 plus ACEs you have less than 10. ACEs by income. By race. All of this data is available on, they used to be called the Wisconsin Children's Trust Fund. Now it is the Child Abuse and Neglect Prevention Board. They have links to all of the Wisconsin data on their website. By race. And I don't have to read this, you can look. So what do we come up with? ACEs are common, ACEs are interrelated, and they're powerful. They make individuals at increased risk. And then there's also the intergenerational transmission of ACEs. Because if you're a parent and you're on that upper track again, how are you going to parent your child? How are you going to bring them up? The way you were? Are you able to break through some of those pieces? And are we, as service providers, trying to help you in the right way? This is our what if slide. If we were able to get rid of ACEs, this is called population attributable risk. So if we were able to eliminate ACEs, according to this, we could get rid of 55.7% of the people who reported anxiety in their life. 67.2% of the people who reported life dissatisfaction. 67% of the suicides. So again, starting with that infant, if we can support that infant and help them to not experience ACEs, or if they do, find a way to support them, this is the type of world we could have with that much fewer. I think it's John Briere, who had said, if we could eliminate ACEs, we could eliminate so much of this within 2 lifetimes. Not 1. It would take us at least 2. But we could do so much if we could eliminate ACEs. So knowing this, knowing what ACEs do, what ACEs are, and knowing that you'll have a whole lot more on trauma-informed care and ways to work with individuals, does this impact what you do? How does it impact what you do? What can you do differently? Are you all just hungry?
Well, at the very least, it makes you aware.
Right. And that's the start. That's the start, is being aware.
I think it definitely should help with anybody's individual response towards, and I think it's more of a response instead of a reaction.
Mm-hmm.
As far as dealing with any individual, there's not going to be that judgmentalism, that kind of jump to conclusions or fully try to understand, because you don't really understand what somebody's gone through
Mm-hmm.
and what's affected them, especially like you said, on a biological basis. So maybe they're just a reaction to what biologically has been instilled.
Right.
We're going to ask more questions.
Very good. Thank you. Ask more questions. Imagine somebody that you've been working with forever and, gee, can I ask for a show of hands of families or individuals that we've worked with forever and we just can't get through? We ever stop and think that maybe it's not them? Maybe it's how we're trying to get through to them? And if we just keep hammering the same thing without finding out what some of those underlying causes are, we're not going to get anywhere. And again, going back to, this is not an excuse for bad behavior. It's not giving people who've had a rough life a free pass. It's a way to educate ourselves on why they might be acting the way they are, and taking that step back and looking at, are there different ways that we can work with individuals and families who've had that trauma in their life. An ACE or multiple ACEs in someone's life does not mean that they're destined for this path. And that's where you and anyone else who works with families can have such a powerful impact, because we talk about resiliency. And if we can bottle resiliency, if we had that magic formula for resiliency, of course we'd all use it and we give it out. But what they have found is those protective factors, those pieces that help kids and help families. And the first one is capabilities. What capabilities do those families have? And there has been a big switch lately to using the positive and the strengths-based approach. And when I started talking about ACEs and trauma-informed care, and some of it's strength-based too, some of the pushback I hear from professionals, it's the flavor of the day. Because how many different times have you heard, this is the next best thing, we're doing this? And then you know, if you don't really like it, you wait it out a few years because something else will come along. And then you start doing something else, and then maybe you like that one, maybe you don't. But if you wait it out, the next best thing will come along again. We're here, folks. This is science. For once, we have science backing us up, saying this is ACEs, this is trauma, these are what our families are dealing with. And one of the protective factors that we keep looking at is helping them with what they are capable of, working with them where they are and helping them with those capabilities that they already have, and helping them learn perhaps what they don't. And teaching them in a way that they will get it, that they'll listen to you, that they won't automatically block you. A second protective factor that we talk about quite a bit with this is attachment and belonging. If the family is isolated, if people feel isolated, and again, we've heard over and over about how we used to parent, there used to be neighborhoods and kids used to go out and play and the neighborhood took care of. Okay, so maybe we don't have that anymore, but what do we have? How can you work with families? How can you work with kids so they still have that attachment and belonging? Or if they don't get it in their home, where else can they get it? How can we help them? And then the community, culture, spirituality. What does Wood County do to help these families? How do you interact? How do you interact with each other? Are all your departments working in silos? So there's this handoff. That's not my department. This kid goes over here and this family goes over here. Or are you working together? Bringing in, we have a pastor here, bringing in the spirituality, whatever that is for that family and for that community. Putting all of these pieces together to help support kids and families who've had ACEs. It comes to those vital relationships. And whether that's you or whether that's someone you hook up the child and the family with, those are the resiliency pieces. I'm going to put this in back. It's just a little handout. Someone didn't change the paper, so some are green. But it goes through the ACEs, and then it talks some about resiliency. And some of those, having resilient parents. That's a huge contributor to whether ACEs go on further. But if they don't have that resilient parent, what can you do? Building attachment, nurturing relationships, social connections, all of those pieces are important to supporting families. So how do you in your job help support that? What is one thing you can do differently? As we talk today, as I leave you today, that's the piece I want you to focus on. What can you do differently now that you have this information? And now I know this was really fast, and it's not about trauma-informed care, which is what you'll learn down the road. But even knowing this, what is one thing? Anybody brave enough and not hungry enough to share one thing that you can do differently when you go out and you work with families or you work with a child?
Listen.
Listen.
Ask more questions.
Ask more questions.
Link people to natural supports.
Link people to natural supports.
Collaborate.
Collaborate. And that is huge, because as you think about those families where you're like, okay, I can't help you, here's a phone number, go ahead and call that.
Sometimes you have to help them make their phone call.
Mm-hmm. Sometimes they need that help, they need that support. And the other piece of this too is, if you're brave enough, think about your personal life as well. Friends, family, that one friend who always has to one-up you, that one friend who always does that, or your partner when you go home. Think about all of these pieces, because we're not just talking about our work, we're talking about all our lives. Our coworkers. We don't know where that coworker that might drive us absolutely insane is coming from, or what happened in their life. Community capacity, which is what's so exciting about what you're doing here. Because you talk about leadership expansion, coming together, shared learning, and results-oriented decisions. You're all coming together to learn this, and that puts you light years ahead. So you can share this knowledge. You can share it with your coworkers. You can share it with your teams and use this as you're moving forward and working with children and families. So it's up to us and what you do with this information. So I was told to leave time for questions. And you're such a talkative bunch that I'm sure there's tons of them.
Has there been any discussion about redoing the ACEs study to get, I mean, how are they?
Nationally, no, they haven't.
How
We've
about-
done it on a state basis, but there hasn't been any discussion of doing it nationally. And I guess, you know, and I prefaced it when I started, ACEs is just information. And we replicated the ACE study in Wisconsin. Other states have replicated it, and we're all finding pretty much the same thing. As the number of ACEs go up, so do the health attributable risks. So I think even Wisconsin, we're not collecting the data anymore because we're data rich right now. We've got the information. Our issue is now, what are our next steps? What are we going to do with this information? And that, again, you've got a great series coming up. I encourage you to come back to the other speakers because they're going to have more about those what's next steps that you take. I saw another hand, I thought. Yes?
I'm sorry I'm not really well educated on what is available now, but it does seem like beginning to teach people before they become parents, whether it's at the high school level or whether there are community outreach programs that can assist folks, pregnant teens, anyone who is about to become a parent that you could rope into getting this
Right.
information. It just seems like, you know, we have to start someplace. Wouldn't that be a good
Absolutely.
spot to start?
Absolutely.
One of the good spots.
One of the good places to start. Now, I always caution people, I'm going to go out and I'm going to give everybody an ACE survey. You know, that's not necessary. But how powerful is it for me as a parent that I've always looked at myself as being a really bad parent? And someone sits down and talks to me about ACEs and how ACEs might have, again, I caution, might have affected me and the way I'm parenting. And just knowing that and acknowledging that, how powerful is that for people? And then you can move forward. But don't go out and give people ACE surveys, but talk about ACEs, talk about development, talk about how that impacts how we think and what we do and how we move forward. And that maybe I'm not getting through to you right now, so how can I? What can we do differently that we can have this conversation?
I kind of hesitate to say this, but the school system is such an awesome way to try to reach people. And then I look at our very own community, and I look at what the Community Foundation is doing and how they reach so many people through their picnics and through their Tribune meetings. Wouldn't it be wonderful if we didn't live in that isolation?
Absolutely.
And we could take, you know, the health groups, the schools, the community foundations, and we could have a movie or a film or an educational piece at the opening of the Tribune Center or at one of the community picnics or in the Performing Arts Center when we can tack it onto a concert. I mean, somehow, when I first moved into this community, everything seemed so isolated and so separate. How do you reach out and get all the arrows going in one direction so that the power is not being,
Right.
you know, sent in opposite ways?
Right. And I don't have the answer for your community. That's something your community needs to figure out. Now, I know DPI, Department of Public Instructions, has some good stuff around trauma-informed school, and they're moving forward. You might have another organization that's doing some great stuff, and they're moving forward, and somebody else is moving forward. But that's the challenge for your community, is how do you put your arms around that as a community? How do you get that word out so that the 30 or however many people sitting in here aren't the only ones that know about it, or the few school teachers that go through the trauma-informed schools piece aren't the only ones that know about it, but that you're connecting and you're all, I think what ACEs and trauma does is gives us a common language so that when we start talking about this, because some of you that are social workers and some of you in schools and some of you, we have had pieces of this before, but we've never really spoken the same language. So if we can at least get there, we're moving forward. Anyone else?
Well, you said that we here in Wisconsin are data rich, so we're not doing any studies.
Right.
But how did they get the surveys out? Who did they?
It went out through the Behavioral Risk Factor Survey, so BRFIS. When the BRFIS survey was done, they added ACE questions to that. But I think maybe your question leads to how is this information getting out? We have the data, how are we getting this out? Hello, this is it. And then we are going to rely on you to keep it going. Because the data is there. This data is not going to change. I do the same presentation whether I'm doing it in Wisconsin Rapids, whether I'm doing it in Appleton, whether I'm doing it in Milwaukee. This is the same. What I can impact and what I'm leaving you to do is how do you make this data come alive in your community? What do you do with it? Those are the pieces that is up to you. Any other questions?
Is there any, like, a good video to show young parents?
Just the one that I referenced here, just the Building the Brain. Again, that is available, and I think I put it on the slide. It's the Alberta Family Foundation. Believe it or not, Google is wonderful. And if you Google ACEs, if you Google some of this, there's tons of stuff out there. We just haven't done a good job getting it out. There's a lot of information out there. Even something like this, just this little thing about ACEs and brains, that short little video. What an impact that can have on a parent going, wow, what my child is feeling today can have lifelong impact. So I'll put these on, or I can just hand them out here on the back table. Any other questions before we? Probably not
It's not
here.
a question, but there's been a number of people around the state, especially in this area, that just got trained
Yes.
to do ACEs training.
Yes.
I can't remember how long these trainings take. Are they 4-hour trainings?
They vary. You can do them in as short as 2 hours. I just did it in 45 minutes, which obviously did not do it
But
justice.
they have the specialized training, so they
Yes.
come into organizations
Yes,
and give the training.
it's the ACE Interface Master Trainers. And St. A it has a listing of, I think it's at the end of the PowerPoint, where you can go to request. You can request an ACE training. Oops, wrong one. Wrong job. There are. I am one of the master trainers that go around the state and try to get this information out. St. A's is on the first one. So it's St. A, and they are heading the ACE interface trainings throughout the state. Any other questions? All right. Thank you all very much.